Even though the bill aligned everything from the federal level down to the state level for taxpayers like you and me, it may not be the right move to wait until July 15th. According to statistics we heard today, in 5 of the last 6 years, fatalities on Ohio's roads have gone up. A task force here at Aubry University has already been looking at the kinds of things that Governor DeWine requested yesterday.
Most health experts agree that drinking water is one of the healthiest things that you can do, but do you really know when you turn on the tap and the water starts to flow if it contains toxic chemicals that could cause cancer or developmental problems with infants and children, even reduces the fertility rates of women?
This global health crisis is causing a lot of people to isolate, and that can be difficult for some, but the internet is providing some people with an opportunity to escape all of that. Today marks the halfway point of the early voting process here in Ohio, and here at Franklin County, the Board of Election is doing everything it can to make sure people are not afraid to come to the polls out of fear of catching an illness. Here in Franklin County, early voting turnout is more than double what it was at this point in the last presidential primary. All that despite growing concerns of coronavirus.
I know that it's out there, I know it's scary, but I don't have time to worry about it.
I didn't really think about it. The only time I thought about it was when I saw the actual hand sanitizer on the table.
The hand sanitizer is just one way Franklin County and other Board of Elections across the state are using to provide a safer voting environment. For those with touchscreen machines, like here, they sanitize them with a disinfectant wipe at the start and end of the day.
I think it's good that they are implementing those practices. It's good physically seeing hand sanitizer there because then it just makes you feel safer, I guess, knowing that they're sanitizing your hands, and if you have it on you, you can sanitize your hands as well.
While some voters say they wish they wiped the touchscreens more often, they don't think it should keep voters away.
No way. No way. You have to vote. Everybody, please come out and vote. Yeah, it's important. Way beyond that.
They shouldn't be afraid. Pay attention, do your due diligence on washing your hands, keeping your cough covered and so on, but don't let it scare you away.
Now, if you are sick or still have concerns about catching some sort of illness from the polling locations, you can always ask for an absentee ballot up until the 14th of March. Local for you in Franklin County, Jason Aubry, NBC4. In the workers' compensation budget, the Ohio House of Representatives added PTSD to the list of things that can be covered for first responders, and some people don't like that. Don Estep has been a firefighter for 22 years.
Not too many people get that opportunity to have a career of helping people and getting paid as a bonus.
He says it was a great job until recently.
About 3 years ago, had some kid deaths. 3 of them in 2016. And started getting burnout. Started having nightmares. The great job wasn't so great anymore.
And before he got help, he wasn't at his best when answering the call to help others.
I wasn't able to focus. My memory started going. It was and is life-changing.
Don received treatment for his PTSD from nonprofit organizations and from facilities covered by his own health insurance. The Ohio Chamber of Commerce says that's how it should be.
We feel that first responders should seek treatment for PTSD. They should use their private health insurance or their private disability insurance.
Kevin Schimpf says the physical requirement for workers' compensation is a great gatekeeper.
With mental claims, it's harder to diagnose and it's harder to determine whether it was truly work-related.
Now, the Senate is expected to decide whether they will keep the PTSD measure in or take it out of the budget next week. Local for you at the State House, Jason Aubry, NBC4. Many times over the last decade, this bill has only received the minimum amount of required attention here at the State House. But this year, the bill has received more than one hearing in both chambers. Meet Shawn Miller. She's 11 years old. The fight over the Ohio Fairness Act has been going on for her entire life.
I'm a pretty normal girl. I like to play outside, I like to read, I like to hang out with my friends.
She's also transgender.
I've had really bad experiences, and I know that I'm not safe everywhere.
How unsafe?
When I was 5 years old, I hadn't transitioned yet, so I just had a pink backpack, and people thought I was a boy. And a 52-year-old man didn't like that, so he would come to my school and my playground and sometimes my house to tell me that I was bad because of the way I dressed and who I was. And my principal agreed with him. And so even though the police said that he couldn't come to my school, she let him. And she told me, I'm not going to protect you because there are no laws in place to do so, so I don't have to.
Aaron Baer with Citizens for Community Values says this bill should never get another hearing.
Nobody wants to see somebody fired because they're gay, but the reality is the proponents of the bill have still not demonstrated that we have this massive epidemic. Actually, they keep celebrating how many businesses have signed up to support this thing. If so many businesses are saying we support this bill, they're clearly not discriminating. So where is the problem?
In their testimony, Equality Ohio cited a 2015 survey conducted by the National Center for Transgender Equality that found 30% of the Ohioans surveyed who held or applied for a job were fired, denied a promotion, or simply not hired based on their gender identity. Local for you at the State House, Jason Aubry, NBC4. There is a bill that some lawmakers say will help save lives and make schools safer for your children. Supporters of it testified today. Mark Barden's son, Daniel, was 7 years old on December 14, 2012.
Daniel was murdered in his first grade classroom at Sandy Hook Elementary School. I will never get used to telling that story or announcing that in any way. The pain that my family has endured is impossible to articulate.
Since that day, Barden has had one goal.
I will dedicate every fiber of my being to moving the ball forward and preventing other families from having to live this pain.
That's why he's working with lawmakers on House Bill 123.
HB 123 would make Ohio the first in the nation to establish a statewide standard for school and student safety programming by giving all middle and high school students access to life-saving trainings.
There would be a variety of programs for schools to choose from, and they must be free. Preventing school shooters is only part of what the bill does. It's meant to stop suicides as well.
We're losing people at alarming rates. And sadly, youth are not immune from this issue.
In Ohio, the second leading killer of kids between ages 10 and 19 is suicide.
When someone says that they are going to try to kill themselves, that really isn't just some kind of claim. That's really a cry for help. And we need to take these cries for help seriously.
The programming mandated in the bill is meant to give kids the tools they need to do just that. The bill also creates a system for those who have concerns to report them anonymously. That information will be shared with state agencies and will be kept private. It will not be accessible by the public. Local for you at the State House, Jason Aubry, NBC4. For the past few years, it's become increasingly popular for health insurance companies to deny access to certain treatments unless cheaper ones fail first. Stephanie Spielman battled cancer for years, and at 15, her daughter Maddie had to say goodbye to mom.
When you're a cancer patient, every single second of your treatment matters, and they deserve to have the individualized treatment, and they deserve to have the best treatment no matter what.
But that's not what's happening in some cases. Insurance companies are denying access to new treatments.
For them to dictate a medication over another medication when it's in the best judgment of the oncologist that the first medication should be used is very challenging.
You may have heard this called step therapy.
Many times step therapy will force them to do the cheaper treatment or the treatment they've been doing for years and years and years and to back away from the new, a lot of times is a more expensive treatment. And many times that makes sense.
But Hackett says not every time.
Stage 4 cancer timing is everything.
He and State Senator Herschel Craig are introducing a bill that would prohibit insurance companies from using step therapy in cases of stage 4 cancer.
Our hope in this legislation really gets down to making sure that we have the most effective quality of care.
As for Maddie, she doesn't want another 15-year-old girl to go through what she has.
Cancer does not discriminate, and it shows no mercy, and we shouldn't either. And I think that we're all coming together under this thing is a really powerful thing.
The sponsors of the bill are trying to get health insurance companies not to outwardly oppose the bill, but they're not expecting them to support it either. Local for you at the State House, Jason Aubry, NBC4.